Hey everybody, welcome back to another live edition here at the Plastic Surgery Group. I'm Terry.
I'm Joyce.
And we're in the marketing department here at TPSG. And today we're going to show you something brand new that we're offering, which is Radiesse hand injections.
Super excited.
We all know as women, what are the first things that show age? Because we concentrate on this, ladies. We are always focused on our faces, but we don't really pay attention to our hands, and that can be the dead giveaway of age.
So again, this is something that we're relatively new to actually injecting hands, but Dr. Wilson is proficient at it, and I actually had mine done a couple months ago, and I'm thrilled with the results of it.
They look fantastic.
So you can see what it looks like a couple months into it. He's going to explain all about the longevity of the product and everything else, but first we want to take a quick look. This is Angie, by the way, head of our skincare department.
Hi, Leslie.
And she's had one of her hands done, her right hand done, right before we went on the air. So you can take a look at that, and then this is the way her hand looks. Yeah. So you can see the tendons, which that's what we tend to see as you fat thins out as we age. So it is a neglected area, something we overlook, but it is telltale. So when people maintain their face, or you notice eyes, neck, and hands are just a dead giveaway. So this is one of those great little ways to turn back the clock and look and feel a little bit better about yourself. So Dr. Wilson, you want to go ahead and inject her left hand?
Yes.
So as we're talking, we're going to watch this. Zoom in on that, Les, so we can really showcase this process.
So we've already done one side, and this is a pretty simple procedure. We'll just do it here in the office.
There is some
The
prep
syringe
involved.
is working, right?
A little bit of prep involved, not too major. So what I'm doing right now, this injection is done right underneath of the dermis or the skin, and we put it in as a series of small bolus injections. So it will look a little bit funny at first, but everything will make sense here in just a few minutes.
So that when I was getting injected, I remember thinking, oh my goodness, this it looks like little gumballs almost under the hand, but under the skin. But once you see the process, it's pretty forgiving product in that you want to inject it there. If you noticed where the tendons were and all the blood vessels in your hands, he's making these little bolus injections, and then we'll massage that out. And it's pretty impressive the way the product easily moves around the hand. And as you could see when I had my hands on, for you to take a look at, it's a beautiful process, I think, with the way your hand will also produce some collagen of its own. So the product stimulates collagen production, and your hand may actually fill out somewhat of its own collagen production.
Yeah. I actually, coincidentally, I recently got engaged. And some family members hadn't seen the ring, so I was taking a picture of the ring, and it bothered me because my hand looks so much older.
So we're going to do you next, right?
Yeah, I need to do it. Well, because you think about that, like especially when you're doing certain things, there's lots of pictures of your hands.
Hands are a dead giveaway, I feel like, for
Hands,
age.
anytime my husband and I play the Guess How Old game, he's not very good at it, and I'll be like, look at the neck, look at the hands.
Yeah.
That's so funny.
Now, Ange, when you have this done, is this painful to you at all, or how does this feel?
Initially, there is a small stick. I mean, I am getting injected with a needle, but it's fine. I'm looking away because I can't watch anything that's happening to myself, whether it's this or getting blood drawn or getting a shot of any type. But
you can see she's not in any discomfort.
Right.
Really.
Now,
I mean,
did you
obviously
say there's any numbing in this?
There is numbing
Yes.
medicine in
Yes.
this.
Okay.
Yeah.
Yes.
So when you start to inject, lidocaine goes in there. And
Yes.
It kind of numbs everything.
So usually the first few sticks are kind of the worst.
But the needle is really small.
Very
it's
tiny,
a very
yes.
tiny needle. Yeah, I mean, it's just a quick prick, and then you don't really feel the product going in at all.
So we're done with our injections already. And now we're actually going to have her sit on her hand, which seems kind of funny, but this will help to just kind of warm the filler up and make it easier for us to
More pliable.
massage it in.
So now, while she's doing that, as funny as she looks there, sitting on her hand,
Warming up the product.
tell us more about Radiesse.
Radiesse is a filler that it was approved in the United States in 2001, so it's been around for a long time. We used to use it, or we still do, mainly before this for filling lines in the face. Primarily, the nasolabial folds were very popular with Radiesse. But Radiesse is now actually FDA approved. It's the only filler FDA approved to use in the back of the hands. Okay. The filler actually contains a mineral that's found normally in the body, in your bones and in your teeth. And the nice thing about it is that it will actually stimulate your body to make some of its own tissue. So in addition to the filling effect you get from the filler, it tends to be that over time, the results are actually getting even better as that process kind of takes over.
Wow, that's exciting.
I didn't know that.
We were just noting that my hands, he actually said earlier, look better than they did.
Yeah, I think they look better than they did originally.
They look fantastic.
When they were injected. So,
Um,
and I feel nothing. You can't feel any product. It just.
Yeah, there's not like bumps and
Yeah.
hot spots or anything.
And I know when I touch her, I mean, it's very natural looking and
touches
feeling.
them.
Like, I would have no idea that she had
It's
had
like you
anything
have
done.
the hands of like a 25-year-old.
I'm an angel.
Now I need the
They
rest
look
of it to
younger
go
than
on.
mine now.
Oh, yeah.
And so the filler, I would usually advise most patients, your body will break down the components of the filler over time naturally and get rid of them. And so I would say most patients will have results lasting for about a year, sometimes a little bit longer, up to 18 months.
Mm-hmm.
And then they may have to have another injection, around that time too.
Yeah.
So
maintain
for
the
those of
results.
you wondering too about the cost, it is a syringe per hand usually, and so we are offering a special. Normally it would be $7.50 per syringe, but
Per
if
hand.
per hand, yes. But so that would be $1,500 for a treatment regularly. But for today's, if you call and mention that you've seen us or comment about it, it'll be 20% off, which will be $1,200 to get your hands treated. I think that's pretty amazing.
I do
I do too.
Yeah.
I seriously, I took like 20 different pictures trying to make my hands look
better.
younger.
Yeah,
I
yeah.
was lifting them and then putting them down and putting them sideways and using all the filters and so this is awesome.
Yeah.
This is awesome.
Yeah.
All right.
We're probably getting about close
Some
here.
massage.
Yeah.
So this is kind of a funny scenario, but the heat from her body will warm that product.
My
up.
bum.
Yeah, from your
Your
bum.
bum.
Will make it easier for him to manipulate. So he's going to glove up and then do a little massage with
A little
ultrasound.
built-in hand massage and
Yeah, so that's another perk.
Bonus.
Hand massage along with your treatment.
Do we get manicure too?
So what I'm putting on now, this is just a little bit sterile ultrasound gel, just to kind of lubricate things and make it easier to do the massage.
And Angie had a manicure before this.
Yes.
So her hands look lovely.
Okay, I didn't even
So I want you to make a fist for
fist
me.
it up. Okey-doke.
As you can see, all these little bumps, now that this is kind of warmed up, we can just kind of massage it in and smooth it around. And we just kind of try to work it into those sort of depressions that develop between the metacarpal bones and really kind of camouflage the tendons and the blood vessels that show up on the back of the hand as we age and lose volume in the...
And right, that's just because you lost fat in that area.
Mm-hmm.
Funny thing about aging. We lose
We
that, but we
lose it.
don't
Don't
want
want
to.
to.
Yes.
Don't want it, and we're like,
Yeah,
yeah,
we put
yeah.
it where we don't
It's
want
just
it.
not
Yeah,
fair.
exactly.
Right.
Exactly.
Now, Angie, does the massage hurt, or are you still feeling pretty numb from the
I feel
injections
very
as well?
little at all,
Okay.
yeah.
And put your other hand up there again, just so they can take a quick look at. I mean, that one was just done right before we started Facebook Live.
And obviously it's still a little swollen, but
Yeah, you will
that's
have a
how
little-
it's smooth.
Yeah, so the most common probably side effects of having these injections are that most patients will get a little bit of swelling, bruising in the back of the hands. That can last for the swelling for maybe up to about a week at most, but most patients it goes away after a couple of days. Hands can be a little bit sore afterwards, so most people after they have the injection, probably for that day, I would advise them just to kind of take it a little bit easy, and we'll
I get to go home after this?
we'll have we'll do some just some ice to help with some of the swelling, and just kind of having her when she's not using her hands, just kind of keep them elevated for today, and that'll help a lot with the swelling.
That said, I went immediately into cool sculpting treatments the day that I had mine done and didn't skip a beat.
You did.
So-
You did pretty well.
Are there any contraindications for this?
Not really. I mean, this filler is really well tolerated. Probably the biggest contraindications would be patients that have an allergy to the filler or to lidocaine, which is in the filler, or if you have a bleeding disorder. I probably wouldn't do the injections.
Okay.
Looks great.
So very minimal discomfort.
Very minimal.
Right.
Squeeze
Easy
it.
peasy.
Sorry.
No, you're good.
Easy peasy.
Lemon squeeze.
No worries.
Can you get a close up again of that hand now? Just show
Wow,
where
you're
those
bossy.
little bolsters are all smoothed out.
She's kind of like that.
I'm the director here.
Oh,
You're the on-air personality.
all right, all right. It's pretty amazing, isn't it?
It really is.
Yeah, it does look cool.
Again, I know we've mentioned this in the past, but if there's anything you want to see, let us know. I feel like we're kind of running the gamut of things that we find really super interesting and exciting, and we've got a couple ideas of things that we want to do coming up. One of them we talked about, and I don't know if everybody's aware, but for women also, when we talked about neck and eyes and things like that that give your age away, a lot of people as they age might notice that they get bands in their neck, platysmal bands. And you can inject those with Botox,
Botox.
which kind of is like a neck lift almost. It gives you a much softer appearance. All those little things that harden your look can be easily taken care of
Oh yeah.
non-surgically, and and that's what we
I don't have many
are.
things to your face for Botox. Not many people think, we can do it for the neck bands.
bands.
We've got a lot of tricks in our bag here. So,
Yes.
just come on in and see us and whatever your problem is. And again, let us know in the comments, everybody. What do you want to see next? We always find that you guys really like to interact with us, so let us know.
Right,
Yeah.
right. So we know what we think is exciting, but we
Yes.
really want to hear from you.
Yeah.
Looks good, Angie.
Does look good.
Mm-hmm.
I don't feel any.
Fantastic.
All right,
Feels
focus in.
pretty smooth.
Focus in on that again, and I think.
That looks great.
So as far as follow-up, there's nothing. Really, we don't need a patient to come back, do we? Or do you check up on it?
No, not necessarily. Unless they're having a problem. I think they could come in to see if obviously if there was anything going on. But other than that, no.
So
No.
one
Just
and
like really any filler that you had injected anywhere else in your body.
Right.
How about bruising? Is there?
People can have some bruising. The idea when I do the injections, we pinch on the skin and lift it up to try to push all the little blood vessels away, so that we don't inadvertently inject in the blood vessel and hopefully reduce our chance of having bruising, things like that. But that could still happen afterwards, and if it does, it's usually not a big deal. It just might have to cover it up for a few days until the bruise resolves, which could be a week or so.
That looks awesome.
Awesome. Fantastic.
All right.
Yes.
And again, it just gets better. So thank you again for joining us for another fun episode here at TPFG.
Yes. And remember, if you guys want the discount, when you call in to schedule your appointment to get your hands all looking nice and great this summer, mention us and you'll get the 20% discount, which will bring it to $1,200, which is a good value. And as always, so like and share us. If you want to get this done, when you call in, mention it. And
did we mention that?
not yet, but if you leave a comment, everybody, you will be eligible to win a hydrofacial. So that's also exciting. Another little giveaway right there. So like, share, comment, spread the word on how fantastic we are here.
Well, thanks, guys. Thanks.
Thank
Yeah.
you.
Bye, guys. Thanks for watching.
Bye.